I bet you didn't know that open enrollment is still on through January 15th. So here's what you need to know to make changes to your plan or to better understand it in the new year. We'll walk through common ways you receive insurance, insurance types, and terms you should know to make the most of your plan. First, how do you get insurance? Well, there's 4 common ways that fall into 2 categories, private and public. Private meaning you or your employer primarily pay for it. These are usually the most common. 65% of insured individuals have a private plan. Of these, most receive insurance through their employer. Over half of those insured have an employment-based plan, followed by direct purchase at 10%. These are plans purchased directly from an insurance company. The second category is public, meaning the government primarily pays for it. 36% of plans are public. These include Medicare, a program for folks over the age of 65, and for those with certain disabilities, and Medicaid, a federal program assisting folks below a certain income threshold. Coverage for these 2 was split evenly in 2023. You should also know 2 common types of insurance, namely health maintenance organizations and preferred provider organizations, or HMOs and PPOs. Both have a network of doctors you can see. However, HMOs typically only cover in-network, meaning your insurance won't cover any providers or bills outside of its network. PPOs, by contrast, allow you to see doctors or specialists in and out of network, although in-network coverage will usually cost less. With an HMO, you must choose a primary care physician, and you typically need a referral from that primary care physician to see a specialist. And from your primary care doctor to your specialist, you need something called prior authorization for costly tests like an MRI or a CT scan. With PPOs, you typically don't need a referral to see a specialist, and you can go out of network and be covered, although it can cost you more in copays if you do. A few more terms you should understand are your premium, or the monthly cost you'll pay for your plan. These can be influenced by factors including your plan type, so HMO or PPO, as well as by how you split the cost with your insurance, also referred to as metal levels, including bronze, silver, gold, and platinum, which indicate in percents how your insurance will split the cost with you. Bronze being the least the insurance company would pay, 60% being on them and you paying 40%, and platinum being the plan where your insurance pays 90% and you would be responsible for 10%. Your share of the cost is also called co-insurance. But sometimes before this cost sharing can even begin, you may be required to meet a deductible, or an amount you need to spend before cost sharing can begin. This is usually reached through copays, which are fixed fees for services such as seeing your primary care physician, a specialist, or prescriptions and other tests. The only thing that doesn't count towards meeting your deductible are your monthly premiums. And even though you're sharing the cost past the point of the deductible and paying your monthly premium, those costs won't go on forever thanks to an out-of-pocket maximum, past which your insurance will fully cover all costs, helpful if you happen to need a lot of care in any given year. Finally, the most you can spend on insurance in any given year is your premium times 12 months plus your out-of-pocket maximum. And with that, thanks for watching. I hope this helps. Happy New Year!